what was the last case, last remedy that we spoke of? We spoke of rhododendron. Okay. And any quick questions in rhododendron? Or what is the main area where you see rhododendron acting? It mainly acts on the glands. And as one of your friend rightly says, it acts on the testicles. Good. Other than testicles? CNS? Joints. So important will be joints. Important will be the connective tissue. And of course, we also saw that its affinity for nerves. Okay. And what was very important, the modality we spoke of. We spoke of a very important modality. What was that? Aggravation thunderstorm. Good. Okay. So rhododendron, a remedy acting on glands, and of course a remedy acting on the connective tissue and more specifically the joints. Okay. Now we'll focus on a very important area, a very simple remedy, but I'll be discussing it through a case. Okay. Now I had a small task for you. Very recently, we had a case of a young boy aged around 18 years, and if you read this statement, it says it's a known case of convulsions. It's a case which had come to my clinic. So through this case, we'll try to understand how do we solve this case and what was the remedy given. Okay. Now my question to you is, as a final year student, how do you approach this case? And I'm very specifically told as a final year student because you will have your own limitations as a final year student, but then we can have some discussion and then we can go ahead with the remedy.
He's thinking about future, where to go.
Okay, he's thinking, this one? No, this is only an image. No problem. At least she is with the PPT, I'm happy. So my question to you is, assuming you to be this person, okay, now what thoughts come to your mind? How do you solve this given case as a final year student? Very good. First question is, since when? Then ailments from how it started, since when? Very good.
Aggravating factors.
Any aggravating factors?
What happens during convulsions?
What happens during convulsions? Good. Is he conscious? Is he unconscious? Very good. Duration. Shivu is talking of duration of attacks. Good. Agreed. Any aura? How often? What is the frequency? Very good. All valid questions. Beautiful. Good. Yeah. And that's what I keep telling you. Must be, when we were in final year, we had no such inputs. Okay. I'm happy you are giving me a lot of inputs. Good. So, systematically, how do you solve? So, it's a very, serious situation where I had was an 18-year-old boy who is a known epileptic. I hope you understand the meaning. When I say he is a known epileptic, what do you understand? Meaning, he has already been diagnosed with seizure disorder. So when I say he has already been diagnosed with seizure disorder, you also know he would have gone through a lot of investigations. And he is also on allopathic medication. So in spite of he being diagnosed, in spite of he being on another system of medicine, okay, his seizures continue. And that's when they came to me, sir, can you do something? Okay. So what you need to understand is, lot of investigations would have gone through. Okay. Lot of investigations the boy would have gone through. They would have diagnosed and they would have accordingly prescribed a remedy. Okay. Petit mal, grand mal. Why I have specifically put this question to you here is because you also have medicine being taught parallelly. So the medicine knowledge also you have to start using. So somebody was talking, sir, was there RR? Very good, it's a valid question. Was there RR? Is a question. Yes, we look at that. And what is the type of seizure? How long it lasts? And as a homeopath, what do we look at this? How is his behavior? Before convulsions, during convulsions, after convulsions, all those minute things make a very important aspect in building a totality. Okay? Hope till now I am clear. Done? Okay. दिख रहा है? नहीं इसमें दिख रहा है क्या?
हाँ दिख रहा है.
Okay. So We'll quickly look at few remedies. We'll look at few remedies. So what I want from you as a final year student is, assuming you have a case of convergence, assuming you have a case of seizures, what are all the probable remedies that come to your mind? Very good. Cuprum, beautiful. Bufo, good. Ethusa, good. It's all there. Cuprum metallicum. Nux vomica. No problem. Any other remedies you can think of? CICUTA, beautiful. CICUTA, okay. So to start with, as a final year student, you should remember a remedy by name Artemisia vulgaris. Artemisia vulgaris. Fine. I mean, I'm just giving you few remedies for convulsions, and then I'll come back to the case. What was there in the case? Homeopathically, how did we take this case and how did we solve this case is what you'll be getting in the next part. So now I'm just telling you the probable remedies as a final year student that should come to your mind is you should have Artemisia vulgaris. Anybody who has an idea what this Artemisia vulgaris is all about when it comes to convergence? Is there in a syllabus? Huh? Okay. See here, emotions will bring on convergence. Emotions will bring on convergence. Convergence after an intense emotion. Convergence in girls during puberty. Or conversions in boys during puberty. Artemisia vulgaris. Okay. And then you also have remedies like Bufo. One of the boys there was talking of Bufo. Now what is special about Bufo?
Solar plexus.
Okay, so you have aura coming in the solar plexus or you have aura in the genitalia. Before. Aura in the genitalia. And convergence after masturbation. Okay, convergence after masturbation. Bufo is a beautiful remedy. We have discussed in third year. Now what is the hallmark of Bufo? Is important to Bufo only? Huh? There are behavioral issues, agreed. But what is special? Addiction to pornography. Okay? Behavioral issues in children, dull children. But the only area that is well developed is the sexual area. Please have this in mind. Okay? The only area that is developed very well in Bufo is the sexual area. Fine? So there is a good amount of masturbation. Wants solitude to masturbate. Bufo, if you remember. Exactly opposite. When I say exactly opposite, what is it? Huh? Very good. Remedy is right. Very good. Hyoscyamus. Now what is exactly opposite in hyoscyamus?
They will expose their
Masturbation in public. You getting my point? Yeah, naturally. They're shameless. They'll expose their parts. And masturbation in public is what you have in hyoscyamus. But here, it's a private act, so they want solitude when they're masturbating. And what is it? Violent conversions. Conversions starts, or the aura starts in the sexual area or the solar plexus. Very important. Solar plexus. So now we look at Cuprum. There was a huge noise when I said convergence.
loss of vital fluids.
Okay, loss of vital fluids leading to. Okay, very good. See, when I said the convergence, the aura starts in solar plexus in Bufo, you'll have to remember in Cuprum, the aura starts in the fingers or the aura starts in the toes. From there, the spasm ascends up. Very violent convergence. Okay? Cuprum, very violent convergence. Convergence after suppressed skin eruptions. Cuprum. Okay? Now we'll go ahead and we'll look at the other very important remedy, hypericum. Simple remedy. You all know about hypericum, but what is hypericum all about? Post-injury. Okay? There is a statement. Convergence post-injury. Convergence post-injury, you can think of hypericum. And the affected part in Cuprum, in hypericum will be very, very sensitive. Hypersensitivity of the affected part is what you have in Cuprum. In hypericum. Okay? In hypericum. Done? So we'll be moving ahead, and the next remedy is Onante. It's a rare remedy, but just because it is a rare remedy, it does not mean you should not know. You should know. Onante. I'll come to it. And you can also refer Boric or Clark in detail once you go back home. Convulsions during menses and convulsions during pregnancy. There are a lot of other indications. As a final year student, I am just giving you a bit so that I expect you to go back home and start looking at these remedies. Onante, and then somebody was talking of Naxwamika. What is special about Naxwamika? Okay, with consciousness, convergence with consciousness. Okay, I have a beautiful case of Nax, I will be discussing a little later. Convergence, Naxwamika, and then you also have Argentum nitricum. Okay, now what is special in Argentum nitricum? Very good, there is anticipation, anxiety, good. Limit to convergence. Let's not put all the knowledge that we have about Argentum nitricum. I am asking you a specific question. Convergence of Argentum nitricum. There is something very special in Argentum. Before convergence, something will happen. Now what is the indication that an Argentum nitricum patient will have before convergence? What is the indication? See, there is an indication. What you need to remember is abnormal dilatation of pupil. What is it? Abnormal dilatation of pupil before convergence. Abnormal dilatation of pupil before convergence is what you have in Argentum nitricum. Then you also have Etusa. Many of you again started, sir, Etusa. Now what is it that you have in Etusa? Eyes turned down. That is very characteristic. Again, Etusa comes close to bufo. You agree? What way they come close to bufo? There is something common between bufo and Etusa. Dullness. Mentally they are not very sharp. Both bufo and Etusa, mentally they are not very, very sharp. Now this is the clarity you need to have. See, stupid children, idiotic children. We have Etusa. Stupid, idiotic children, you can think of Etusa. See, there are many more remedies. Now, I did not give any of these remedies in the case that I shared with you. Now, any reason why I did not prescribe any of these remedies?
Symptom was not matched.
Beautiful, very good. Similia, similibus curanter. One of your friends says, sir, must be that patient's symptom did not match with any of these remedies. So, as a homeopath, I did not give him that particular remedy. Now what is the remedy? So what is the remedy that I prescribed and why did I prescribe? Will slowly unfold. From your knowledge of pharmacy, any idea? You remember seeing this somewhere? Must have picture.
It's similar to Ruta,
Okay, similar to Ruta, okay.
appearance.
Okay, then anything else? See, there is a family. Now the remedy that I am going to unfold today is a remedy which belongs to this particular family. And this family is Umbelliferaceae. What is it? Umbelliferaceae. As a final year student, again, any other remedies you can recall prepared from Umbelliferaceae family. Okay, Etusa, good. Very good. Who was that? Hydropetal, good. Yes, I am happy. A boy's voice always, even if it is wrong, we are happy. Good. But it's the right answer. Hydropetal, good. Hydropetal. Yes, anything else? Etusa, absolutely right. Okay, see, another remedy, again, which can affect the nervous system. More than convulsions, it will cause more of paralysis. And one of the Greek philosophers was poisoned with this particular plant, and that is conium. Conium also belongs to Umbelliferaceae. Okay. Now the remedy or the remedies that belong to Umbelliferaceae family, there are many. Some 22 remedies you have. Otherly, conium, cicuta, etusa, asafoetida, onanthus, hydrocotyl, phalanthrium, sambal, and there are a lot of other remedies from this particular family. Now, we will be discussing a remedy which I gave to that particular patient, and it is one of the remedy that we have in this particular list, and the remedy is CICUTA virosa. The remedy is CICUTA virosa. So next 40 minutes we'll try to focus, or we'll try to understand what CICUTA virosa is all about. Okay. The CICUTA virosa, when I was reading it in Wikipedia, a lot of information given, and it was also told in olden days. In olden days, the Europeans, they used to use this particular plant as a poison to punish people. If somebody writing against the emperor, somebody going against the emperor, they were jailed, but they were poisoned with either conium mac or CICUTA virosa. Conium, what is the common name?
Poison hemlock.
Very good. And this is called water hemlock. Conium, common name is poison hemlock, and CICUTA, common name is water hemlock. Okay. And more, if you read in your Google, in Wikipedia, they also say that it contains a toxin. Now why CICUTA? What I am just trying to do here is, I am trying to justify, or I am trying to connect that it has a poison called as CICUtoxin, which is a neurotoxin. Okay? And this CICUtoxin affects the nervous system. It affects the nervous system. Affecting the nervous system, what exactly this CICUtoxin does? Okay? It causes tremors and it causes seizures. So what I am indirectly trying to tell you is, when it was proved, we homeopaths proved that CICUTA has an affinity for nervous system. Many of our provings, or many of the case histories you see where CICUTA was given as a poison, the old toxicological records, it was seen, or it was observed that it is a neurotoxin, and many of them had bad seizures and they died thereafter. Okay? So what I want you to understand is, now what is this information, this piece of information telling us? What is it trying to tell us? Or what will be our next heading? Very good, beautiful, sphere of action. I hope you are able to link things. Fine? We started with a case, and then we started with remedies for convulsions, and then we are looking at CICUTA, and we also saw that CICUTA is a beautiful remedy acting on the nervous system because it has got a neurotoxin, CICUtoxin. Okay? So what you see is, when you read our literature, when you read the homeopathic literature, what you see is, the sphere of action of CICUTA is predominantly on the CNS. They say brain and the nervous system. Dr. Patak. Okay. So brain and the nervous system. So what is CICUTA doing? It causes two very important things. It causes spasms, or we just saw what it is capable of causing is, it can cause convulsions. It can cause convulsions. Okay? So hope I am clear. We are going very systematic, stepwise. Sphere of action, spasms and convulsions. Okay? So moving ahead, what you also have to remember is, my class of CICUTA, I have divided it into two parts. Today, next 20-25 minutes, we will be focusing exclusively on the convulsions part. Okay? Next class, another 30 minutes, we will be focusing on the mind part. You have beautiful mental symptoms of CICUTA. So in the next class, we will explore the mind symptoms. Today, the focus is only the CNS affections. Okay? And this is one 5-mark question very often asked in your exams. Describe the convulsions of CICUTA. So focus, and any remedies that comes close to you, please share so that we can have some kind of a discussion. We can compare remedies and it will benefit all of you. Now the first question is, what is CICUTA capable of producing on the nervous system? So when I ask this, I want you final year students to answer from your knowledge of medicine. Okay, I told you it causes spasms, it causes convulsions, and it also has an affinity for the nervous system. So what could be the probable disease conditions you can think of in CICUTA? Huh? Very good. Who was that? Good. Tetanus. Trismus, lockjaw, tetanus. Good. You saw that?
Parkinsonism.
Okay, so must be it's a good thought. What made you think of Parkinsonism?
GABA neurotransmitter.
Okay, so must be the spasms. We have more of spasms here. I didn't mention tremors. So in Parkinsonism, you see more of tremors. But I am talking of spasms. Okay, I am talking of spasms. Done? Done? Okay. So at least the books does not mention, or I'll have to refer. I am not very sure. Under Parkinsonism, I am not very sure. Must be in the next class. We'll explore. I'll check and let you. Anyway, good thought. So one is tetanus. Then anything else? Think now from knowledge of medicine. Okay. Epilepsy itself can be a possibility, and cerebrospinal meningitis. Okay, cerebrospinal meningitis, concussion of brain. I'll discuss this. Trismus, lockjaw, or tetanus, convulsions. These are few things possible, and in today's class, the main focus will be on convulsions. Okay. Now we'll be exploring two areas here. As a final year student, how do you study convulsions? Or your focus will be exams. So how do you write the topic convulsions in your exams will be the first area that we are looking at. As an extension, we'll also look at tomorrow when you become a clinician, when you start practicing, what are all the things you should have in your mind when you are treating a case of convulsions. Two things we'll give, so that we do justice to you today and we also do justice to you tomorrow when you grow up as a physician. So convulsions, what are all the common headings under which we explain? Or assume you have a patient of convulsions sitting, or you have patients of convulsions, in front of you. What is it that you observe? Okay, you look at the
Body attitude, like position.
Okay, you look at the position. What is it that you look at the position?
Facial expression and stance.
Okay, so how is this body posture? Is it bent back? Is it bent forward? Good, very good. To start with, yes,
We'll be
I'm happy.
looking for eyes. whether
Okay,
it
you
is
also look into the eyes because you have down. Generally, we see in convulsions, eyes are rolled up. Ala. So, Yetuzana, E casu, you are also trying to explore. Good, very good.
Any fraud is coming.
Any fraud is coming. Good.
Are they conscious?
Are they conscious? Are they unconscious?
From there.
Many times in our Bollywood movies, we see, hero or heroine will have convulsions, and then she will be somewhere and she gets up and she'll ask, "Main kahan hu? Kya hua? Kyun hua?" and all those things. Meaning, she was not aware that she had a convulsion and then she became unconscious. And there are people who are conscious of what is happening. Okay, good. So anything else? Anything else?
From where is she?
Huh? Yeah, before conversions, will you get an idea? So what do you understand by aura?
Like
An indication. Okay, good, correct. Yeah, you are all right. It's a feeling. Sir, aura, like before conversion, something happens, sir. Some weird thing happens. Or I become irritated, or I become angry, or this thing moves, that thing moves, something happens. Do you get any indication? So then we have something called as conversions with aura. Okay, good. And then there are patients who will not know. They will not know anything. Sir, last 20 years I have been having convulsions. Must be some 40, 50 times I've had. But there is no pattern. I will not know if I am getting convulsions. So that is convulsions without RR. Very good. Good. I appreciate it.
Any specific time modality or specific
Good. Yes. Any specific time. Now what is this? Good. What is this when you say any specific time? Yeah, good. That's the right word. There is something called as periodicity. So is there any pattern? Is there any periodicity? Is it happening in the day? Is it happening at night? Night when you are awake, when you are sleepy? Lot of questions. Good. I am happy. Huh? Jara? Fever, yeah, good. So this, your friend is talking of, this is more relevant when you talk of kids. So there's something called as febrile convulsions. Okay? So sir, whenever he gets 102, 103, 104, he throws a convulsion. So I'm very careful. I don't see to it his fever goes above 101 because he is prone to febrile convulsions. Good, appreciate. Anything else? Huh? Any triggering factors, any emotions? When do you get? When you are upset you get. Okay. When something happened against your wish you get. Yeah, good. What is the trigger? Yes? These are all the questions you need to ask. Now today I have given you some headings. If you remember these headings, it will be easy for you to write and of course practice in your clinic tomorrow. Now what are all the headings? Systematically, the first heading will be ailments from. Okay? What causes? What brings on a convulsion? What brings on a convulsion is the first question, and that is what we call it as ailments from. See, as a homeopath, you know ailments could be many. Ailments can be any damn thing. Now we are specifically talking of CICUTA. So we will be looking at ailments in CICUTA. Okay? Now one very important ailment you need to remember is head injury in CICUTA. Convulsions after head injury. I will be talking more under mind because there is a beautiful correlation of CICUTA and head injuries in mind. We will look at that. The convulsions, head injury, dentition. What is the other remedy that should come to mind? Ethusa. And Ethusa also belongs to Amblyophareaceae family. Okay, fine. So ailments from head injury, injury to spine. A better remedy? From the list we spoke, hypericum. Good. From the list we spoke, hypericum. Worms. Cinna. Cinna, there can be a lot of neurological complaints coming up because of worms. Suppressed eruptions, we saw this. Cuprum, good. Many metals, not only cuprum. One more metal where you have conversions. Zincum, very good. Plumbum. What is the character of conversions, or why do you have conversions in plumbum? No, good. I forgot. Thank you for reminding me of plumbum. In plumbum, there is sclerosis. What do you understand by the word sclerosis? Good, hardening. Cirrhosis of the cerebrum. Cerebrum becomes hard. Okay? Or tumor in the cerebrum. And secondary to this, you will have conversions. That is plumbum. Should I repeat? So in plumbum, conversions will be secondary to cerebral hardening. Cerebrum going into sclerosis or any tumor in the cerebrum. And as a secondary result, you have conversions. One remedy you can think of is plumbum. Okay? So ailments from is very important. And after ailments from, the second heading will be the character. I am generalizing a word, character of conversions. Now when I say character of conversions, what will be the headings that will be coming up? Modalities will come in the end. Character.
How long? How many episodes?
Is it mild? Is it severe? Okay. Is it single? Is it multiple? These are the characters. Yeah, we'll come to it. Okay. So what is very important for you is, in CICUTA, the character of convulsion will be violent. Character of convulsion is violent, one fit followed by another. See how nicely given in your books. There is one episode of a seizure and again you have another. Ek ke baad ek. Fine? One after another. Violent, one followed by the other. Convulsions can also happen during pregnancy. What is it? What is the word? Eclampsia. Good. Eclampsia. Convulsions in meningitis, convulsions in encephalitis, convulsions postpartum, meaning convulsions in the purpurium. After delivery, if a lady can also have convulsions, postpartum convulsions or postpartum seizures, delivery admit, there again you can think of CICUTA. Okay. See, please understand, not all of these cases will give CICUTA. Now what should be the next question that comes up to your mind? What is the next question? Sir, what is the specialty of CICUTA conversion? See, tomorrow a lady comes to you telling, ma'am, during pregnancy I have conversions. CICUTA can be one remedy, but you are not giving CICUTA to all ladies. You cannot stand outside the obstetrical ward and keep distributing CICUTA. No, you can't do that. CICUTA will have its own character. So what is the character also becomes very important. Okay. So there is something called as convergence before. What will happen before convergence? What will happen? What will happen? What will happen before convergence? This is very important. This is how we question in clinics, and going through the CICUTA from your source books, I have just made it simple for you students so that you can have a clarity. And the same model can be applied to cuprum, naxvomica, ethusa and all other remedies. So here what you see is before convulsions, there is something called as shrieking. Now what is shrieking? Screaming. Something that is irritating. And when somebody is shrieking, what generally we do is our hands goes over our ears. Right? A penetrating noise, shrieking. In Kannada we use the word kirchodu. Right? Screaming, shrieking, child shrieking and crying. A very irritating thing. Okay? So shrieking is one possibility. Staring eyes. Many times people tell now before convulsions, you just keep staring at something. Then staring eyes and jerks of eyeballs. The eyeball, there will be jerky movement of the eyeball. So these are the things improving and clinically our stalwarts have observed in CICUTA before convergence. All clear? Before convergence. The very important is what will happen during convergence. Now to bring you back to the track, CICUTA, we first spoke of the spare fraction, and then we are focusing on a very important area of CICUTA, and that is convergence. We spoke of the ailments from, we spoke of the character. Now we are looking at what happened before, and we are now going to explore what will happen during convergence. Okay, very quick inputs, what will happen during convergence? During convergence. One of your friend was talking of something. Okay, good. Epistotonomous. Correct, agreed. Now, I'll also go with the PPT, but you need to understand, there is distortion. Now what is distortion? Huh? I mean, if you look into Google, it says twisted or abnormal, not normal. So the face muscles, they go into distortion. So in a CICUTA patient, when he's got convulsions, you'll be seeing a lot of facial activity, face going to like this. I have, that's how that case is that I have with me. Fine. There will be a lot of, facial expressions. Fine. So grimaces, distortion of face, the facial muscles, they go into spasm, and his face gets distorted. It is not his normal face. Okay, I don't know, something like this, it goes into a different thing, right? So distortion. distortion of face, then very important. And then we are also trying to understand there can be, I was talking to you about violent convulsions, so tongue bite is a possibility. There can be froth coming from the mouth, and this froth, whatever is coming, is bloody. There is tongue bite, there is bleeding, and the froth is bloody. Okay? Then arching of the body forwards. See, what is apis autonomous?
Backwards.
Fine, I can't do that here, but what you need to understand is everything goes into an arch shape. Okay? Done? So, apis autonomous is very important, what you have here. Spasms move down with shocks through whole body. Distortion of the facial muscles, very important. Rolling of the eyes upwards, is a common symptom. The facial expression in CICUTA is red face with blue lips. Bloody froth from the mouth. Drawing head backwards. Okay, this is what I was trying to tell you. Drawing head backwards. Arching of the back, apis totonus. Very important. Any other remedies you can recall here? Naxwamika. Yes. Naxwamika, opium. Biting tongue. You saw this. Biting tongue, locked jaw, vomiting, and this is also very important. Involuntary urination and stool. Hope you are getting it. So we are trying to systemize, or we are trying to make it very simple and clear for you students that convulsions can be learnt in a format. Ailments, or before ailments, sphere of action, ailments, character, and then what happens before, during and after. So we are here understanding what will happen in CICUTA during. Okay. Now we'll quickly look at what will happen after. Any idea what happens after? Now if you read tonic-clonic seizures in your medicine, please go back home and just read convulsions. You have something called as post-ictal phase. I don't remember the other things. See, that's what. Before convulsions, during convulsions, and after convulsions. In your medicine book, they have given it as post-ictal phase. Now what is post-ictal phase? After convulsions. Okay. Now for you it is also important as a homeopath what each patient does after convulsions. Okay. What each patient does after convulsions. My experience with convulsions are not all that great. I have very few cases and few successful, few we are still trying to find the simillimum. But one case, after convulsions, this boy generally becomes very irritated. So there is a rubric, anger convulsions after. Anger convulsions after. I have taken that. Because not every patient after seizure or post-ictal phase, they will be angry. I will be showing you CICUTA. Though it is a very violent remedy, you don't see anger in CICUTA. Right? So we'll try to understand what is it that you see in post-ictal phase of CICUTA. There is no anger, then what is it that you have in CICUTA? Right? So what is very important for you is, the post-ictal phase of CICUTA is generally long. Meaning, after that convulsions, he will go into an unconscious state. Okay? One of the books says must be 30-40 minutes, he is drowsy, he is unconscious. Dull, blank, childish behavior, loss of memory. He forgets what had happened before convulsions, weakness of limbs, profound exhaustion. Now this is very, very important. The last line. It is contradictory to what I just spoke to you. What did I tell you? In my case, the patient had gone into an angry mode. Now here what you see is, the patient is contented, happy, look like an angel after convulsions. He looks like an angel after convergence. Angel when well, devil when sick. Which is the remedy? Angel when well. When he is fine, he or she is like an angel. Or when she is sick, no. She will have the devil character. Now that is belladonna. That is belladonna. Here, after convergence, you have a happy, contented face. Now that's very, very important. Okay. Now very quick questions in the convergence, which is a 5-mark question, and it's important to understand. It's important to have a thorough understanding of the convergence in CICUTA. So what you need to understand, once you go back home and read other convulsive remedies, each convulsive remedy is different. This is the challenge for a homeopathic student. This is the challenge for a homeopathic student. Okay? Fine? Now, apart from convergence, there are 3 more symptoms I'll just describe. Then we'll have a quick revision and then we'll close. Okay? Because next class we'll be dedicating only to the mind of CICUTA, which will be very interesting. Okay? So we'll come back to the head symptoms. Under head, what do we have? What do we have is, headache after head injury. Headache after head injury. Other remedies? Very good. One top remedy is natamsal. You also have arnica, you also have hypericum, you also have many other remedies. So, headache better by passing flatus. You have one final year remedy you can think of. Headache better by passing flatus. Which is that remedy? Sanguinaria. Sanguinaria. Headache better by erectations. Headache better by passing flatus. So, what does this indicate? Beautiful. Who is that? Gastric headache. Good. It's little dark. I am not able to see you all. What you need to understand is that headache is of a gastric origin. That headache is of a gastric origin. We'll go ahead and we'll also look at this particular image taken from Google. What is a quick interpretation looking at the image? There is something. So beautifully the image mentions normal eye, strabismus. And in strabismus you have 2, convergent and divergent. So convergent is coming close and divergent is going away. Okay. So squint, convergent squint, divergent squint. When we treat squint in clinic, we have a different approach of looking at squint. Okay. But here you need to remember, CICUTA will have convergent squint. Okay. CICUTA will have convergent squint. The only remedy for convergent squint after a fall or after a blow. So if you're lucky tomorrow, squint was not congenital, he was absolutely fine, he had a blow or he had an injury, and then he started with convergent squint. Single remedy is CICUTA. Okay? Squint after fear, squint after emotions. And you have some 2-3 remedies mentioned in your repertory. This is one such remedy. Okay, CICUTA. And the last area, what is it? Yeah, desires undigestible things. Any other remedies?
Calcareous.
Very good, calcareous. See, you are finally a student. You should be eager. You should be, you should have that desire to give more, learn more. Calcarea, I have nothing against calcarea. But what I expect from a final year student is, when I give you 1, you should give me 10. Right? That should be the kind of, update, or that should be the kind of knowledge you guys should have. Calcarea, absolutely right. Any other remedy apart from calcarea? Good, nitric acid. Looking back into the notes, nitric acid. Alumina. Okay. You also have alumina. Calcarea, alumina, nitric acid, CICUTA. See the beauty. Each remedy will have its own reasons for having pica, or for eating chalk, or for eating charcoal, you know. Now one author so nicely says, in CICUTA, the reason is craves coal, chalk and many other strange articles. See this is very important. From inability to distinguish between edible things and unfit to eat. See, not that, I hope you are getting this, it's a very simple English. Not that they love chalk or charcoal, but there is no intellect to understand that charcoal or chalk is something that I should not eat. That clarity they will not have. Okay? See, calcarea will have deficiencies basically. And nitric acid is syphilitic. They will have all unusual cravings. Right? And calcarea mainly deficiency. Somebody has desire for charcoal, chalk, undigestible things, the first thing you should do is get their HP done. Get their hemoglobin checked. At least as a homeopath, your finger should go, at least check for pallor. Fine? This is very, very important. Many times when the hemoglobin is corrected, automatically the desire for chalk goes away. You getting my point? So, in calcarea it's more of deficiencies. In nitric acid, the desires only are very syphilitic. All unnatural, unusual likings they will have in nitric acid. And in CICUTA, is not able to differentiate. Is this edible or is this not edible? That is CICUTA. Okay? So I am pitching up my field for my next class on the mind part. Because now you also get an idea about the mind of CICUTA. What is it that you are getting? The dull people, naturally. When you are not able to distinguish between what is edible and what is not edible, you are not an intelligent guy. So, in the next class you will be expecting CICUTA to be somebody who idiotic. We will look at that a little later. So, the last part I want to mention here is the skin. You will have more of pustular eruptions. Eruptions which are yellowish. Thick yellowish caps and there is burning pains. Burning pains. Can somebody add something else here under skin? Eruptions? If you are concentrated on the initial part, this question will become very easy to answer. Very good. Suppressed skin eruptions will lead to convulsions. It was an ailment. It was an ailment. Okay. Now before we close, quickly we'll have a quick revision of what we discussed. Now, under what headings we described CICUTA conversions? So CICUTA conversions was explored under ailments or before ailments? Sphere of action. Where do you see CICUTA acting? Brain and CNS, causing spasms and conversions. Clear? Okay. In case if you are not focused, it's also a very good opportunity to focus in the end. Okay. Now the second very important thing will be ailments. Ailments from head injury, spine injury, dentition, yes, suppressed eruptions, agreed, suppressed eruptions, bones, 5. Okay. And then we are looking at what will happen before. What will happen to the eyeball? There will be jerky movement or there will be staring or shrieking. And what will happen during? Very good, important. Distortion of the face, the facial muscles. They go into distortion, yes, good, tongue bite, bloody froth, apis autonomous, involuntary urination, involuntary stool, there can be vomiting, yes, good, agreed. Red face with blue lips. Please don't forget, it's all important. After, they feel weak, they feel exhausted, there is childish behavior, agreed, and very contented, angel, happy, lively angel after conversions. So good. Yeah, so this is after conversions. So in the next class, I'm just giving you a small clarity. We will be looking at the mind symptoms of CICUTA. The idea of me giving you this topic in advance is an expectation. You go back home, you read the mind of CICUTA and you come back, right? So that it will be easy for me. You can refer basic books. Kent's is a beautiful book. Okay, you can just check in Kent's, or E.F. Harrington, Boric, Clark. You are a final year student. Dr. Phatak, Dr. Chaudhary. Okay, there are Dr. Methodical, and you have books also written by Dr. Vijaykrishna, Dr. Shankaran sir. You have got plenty of books. Don't be very stingy in referring books, because each stalwart they would have given their thought, and you are in final year and you will have a lot of space in your mind to accommodate all of them. Okay, so you will have some 15 days time. That's when we will be meeting next, if I am right. So kindly go through all the books, and you have some first-hand information about CICUTA mind, so that we can relate that to our case that we have taken, and we'll conclude. Okay? Boys behind, any questions? All clear? Children, thank you. Thanks.